Good evening, everyone. There is breaking news tonight regarding that mystery illness affecting children and now being linked to coronavirus. Late today, the CDC taking steps to track just how many kids are getting sick with multi-system inflammatory syndrome and issuing new guidance to help doctors recognize the illness that so far has been considered rare but is appearing in more and more states. And that's where our reporting begins tonight with Kristen Dahlgren.
The alert was sent to thousands of doctors across the country, outlining what the CDC is now calling multi-system inflammatory syndrome in children, or MIS-C. The document lays out criteria for the illness, including fever, inflammation, at least 2 organs impacted, and a positive test for COVID-19 antibodies or COVID exposure 4 weeks before the onset of symptoms, which are described as similar to Kawasaki disease, including rash, red eyes or tongue, and abdominal pain.
This is not a subtle disease.
Dr. Jeffrey Burns has been coordinating a group of more than 1,000 doctors comparing notes on the syndrome.
We have linked together these research centers across the United States and now the world rapidly in the last 2 weeks. And we're working as hard as we can to find the answer to this.
Today, New York City confirmed it now has at least 100 cases.
We have to understand it better. We have to get ahead of it.
New York City reached its peak of coronavirus cases on April 6th, about 5.5 weeks ago. So tonight, experts warn other parts of the country could see inflammatory syndrome cases spike between 4 and 6 weeks after their COVID-19 peaks. NBC News has learned at least 19 states are investigating cases of the inflammatory illness, believed to be an overactive immune response. There's no apparent pattern to which kids get sick. In Illinois, Amelia went from a happy 4-year-old to a ventilator in just days.
Everything started filling with fluid in her lungs, her heart.
Her pregnant mom couldn't visit the hospital.
To not be able to put the hands on your child when they're in need.
Like most kids, Amelia is now getting better with treatment, but 3 have died. Doctors say learning more about this rare immune response could ultimately help them understand COVID-19 and develop a vaccine.
I hope more families don't have to do what we had to do.
Hope tonight, a new alert helps them know what to look for. Kristen Dahlgren, NBC News, New York.
Meantime, on Capitol Hill today, the prognosis was grim and the prominent government doctor who delivered it marginalized tonight by the president over his warning that unless the administration improves its response to the COVID outbreak, our worst days are still ahead. Here's Jeff Bennett.
A new warning tonight from a former top U.S. vaccine official who says the worst of the coronavirus crisis could be yet to come.
If we fail to improve our response now, based on science, I fear the pandemic will get worse and be prolonged. Without better planning, 2020 could be the darkest winter in modern history.
Dr. Rick Bright was ousted last month as head of the federal agency involved in developing a coronavirus vaccine. He filed a whistleblower complaint alleging he was forced from his job for objecting to the wide distribution of hydroxychloroquine, a drug promoted by President Trump as a remedy for coronavirus. Studies later suggested the drug may provide no benefit and can lead to heart problems. Dr. Bright telling a House committee today that the Trump White House missed early warning signs about the pandemic.
Our nation was not as prepared as we should have been, as we could have been. I believe Americans need to be told the truth. I believe that the best scientific guidance and advice was not being conveyed to the American public.
And that the administration ignored repeated red flags in late January from the nation's largest manufacturer of medical masks.
I'll never forget the emails I received indicating that our N95 respirator supply was completely decimated. And he said, we're in deep shit. The world is.
Dr. Bright also casting doubt on the administration's timeline for a coronavirus vaccine.
I still think 12 to 18 months is an aggressive schedule, and I think it's going to take longer than that to do so.
Adding that even if a vaccine becomes available soon, the federal government doesn't have a plan to distribute it.
There's no one company that can produce enough for our country or for the world. It's going to be limited supplies. We need to have a strategy and plan in place now to make sure that we can not only fill that vaccine, make it, distribute it, but administer it in a fair and equitable plan.
And that's not the case at this point.
We don't have that yet, and it is a significant concern.
As he was testifying, instant angry reaction from President Trump and Dr. Bright's boss, Health and Human Services Secretary Alex Azar.
To me, he's nothing more than a a really disgruntled, unhappy person. And I'm not just talking about Alex, because Alex said it strongly, but there are a lot of people that do not like the job he did. I don't know him. I never met him. I don't want to meet him.
Everything he talked about was done. He says he talked about the need for respirators. We procured respirators under the president's direction. He said we need a Manhattan Project for vaccines. This president initiates a vaccine Manhattan Project.
I think we're going to have a vaccine by the end of the year. And I think distribution will take place almost simultaneously because we've geared up the military.
The president making a day trip to Allentown, Pennsylvania, his second visit in as many weeks to an election year battleground state. Today, touring a medical supplies company. Mr. Trump choosing not to wear a face mask during his visit, while other government officials did. Meantime, the CDC tonight releasing some of its long-delayed guidance about how and when to reopen public places like schools, shops, and restaurants.
The CDC drafted the recommendations more than a month ago, but they were shelved by the Trump administration for being too restrictive. The agency has reportedly drafted more extensive reopening guidance, which still has not been released. Lester?
All right, Jeff Bennett tonight, thank you. And staggering new numbers on job losses today, fueling the battle over reopening and new protests against stay-at-home restrictions as one governor warns of new infections and deaths. We get the latest now from NBC's Miguel Almaguer.
Tonight, as states across the nation face pressure to reopen local economies amid the confusion and confrontations, there is celebration in Wisconsin. Bars and other retailers are now getting back to business after the state Supreme Court rejected a stay-at-home extension that would have prevented scenes like this.
I don't think that the risk presents any higher than me going to a grocery store.
The governor, who notes the state has one of the lowest number of coronavirus cases per capita in the Midwest, says the decision will lead to more infections and deaths.
We are the Wild West. There are no rules, no regulations. There's nothing that's compelling people to do anything other than having chaos here.
With new protests, the bitter battle over staying home comes amid a grim jobs report. New weekly unemployment claims nearly hit 3 million today, as 36 million Americans filed for unemployment benefits in the past 2 months. Outside Salem, Oregon, Carrie Sussums is watching her business slip further away.
It's just been so difficult. We're maintaining. We're getting up. We're coming here every day. We're doing our best.
As overwhelmed and understaffed food banks help more Americans, the chairman of the Federal Reserve warns the economic damage to our country may be permanent unless Congress acts. Even essential workers are losing money.
Early on, some retailers and grocery stores added hazard pay for essential workers, an extra few dollars an hour. And now Kroger, which owns Ralph's, is ending that this weekend. Amazon, Target, and Walmart doing the same soon.
While signs of a new normal are emerging, the Mall of America opens next month. Another icon, McDonald's, will close play areas and some tables as employees wear masks and gloves. It comes as states like Ohio allow pools and outdoor activities to resume, while Illinois just recorded its deadliest day of the pandemic.
In nearly every state in the country, it seems with each step forward, there's also a step back. Here in Los Angeles, where beaches just reopened, more businesses can do front door or curbside pickup. But the mayor just mandated anytime anyone goes outside, they must wear a face mask. It's the face of a new reality. Lester?
Lots of tough choices. All right, Miguel, thank you. Tonight, an update on one of our own colleagues now battling the coronavirus. NBC News science contributor Joseph Fair, a virologist and epidemiologist, is speaking out about what he wishes he would have done better to protect himself from COVID-19. Kate Snow spoke with him from the hospital today.
How are you feeling this afternoon?
So much better than I was on Monday. I can breathe, I can talk to you, which on Monday we would not have this conversation.
Joseph Fair has spent his life chasing deadly viruses, but tonight he's still on oxygen in a New Orleans hospital where he was taken by ambulance on Monday. He believes he caught coronavirus on a flight 2 weeks ago, even though he was wearing a mask and gloves.
My best guess at this point, because I was not wearing any kind of eye protection, was that it came through the eye route.
Should we all be wearing some kind of eye protection?
In my opinion, yes. You know, people tend to call people like me fearmonger and things like that, but the reality is we're just trying to keep you safe.
The CDC does recommend eye protection for healthcare workers.
Well, I think eye protection is very important in the healthcare environment, but for the general community, I think that's a step too far.
Airlines say they're trying to keep middle seats open when they can, and they're requiring masks. But Joseph says that's not what happened on his flight.
And it was packed completely. I had someone sitting right next to me. None of the attendants were wearing masks. And,
did you think about getting off?
In retrospect, I should have followed my instinct and done that.
Joseph has been tested for coronavirus 4 times, and each result was negative.
I waited about a week to go in, so my virus might have cleared my system. And then secondly, these tests aren't perfect.
A review out yesterday by Johns Hopkins found on the first day of symptoms, there's a nearly 40% chance of a false negative on a diagnostic test. The false negative rate drops to 20% 3 days later, which the researchers say may be the optimal time for testing. Joseph is feeling stronger by the day.
I could be going home as soon as Saturday, but maybe Sunday. Let's hope.
Cross fingers for you.
He also hopes people continue to take the virus seriously. Kate Snow, NBC News.
We're rooting for you, Joseph. And on that risk of crowding on planes, tonight the head of the House Transportation Committee is urging airlines to keep at least one seat empty between all passengers and to limit seating on planes to no more than 2/3 of capacity. The new push coming after some passenger videos went viral showing crowded planes. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.